Dear ladies and gentlemen, food intolerances are really an increasing problem in the medical fields. We got a lot of clients with different food intolerances, and we see very often a problem with the mainstream medicine because they don't diagnose that in the same way. This is because we have a problem in the diagnostics of allergies. If you think you have a food intolerance, an allergy, and you go to your doctor, he has a few possibilities to diagnose that. If you fall into the system, if you have exactly the reaction they expect, be happy, then you have an allergy. But this is in less than 5% in the population. All the others, they have the same complaints, but not, these complaints can't be identified in the mainstream diagnostics. Therefore, we need a new understanding for food intolerances, and I'd like to introduce you into this understanding of food intolerances. We see from the reactions in the modern Mayr medicine, we have so many clients with complaints from food intolerances. That could be that you have a lack of energy, that your concentration is reduced, that you are complaining not having the same energy power you had before. Additionally to that, you also can have some very specific reactions, especially in the intestines, related more or less to your intake of the food. So if you have a reaction about 20-30 minutes right after you have taken your meals, that could be related to food and specifically to food intolerance. But it could also be that, for example, a rheumatic disease is related to a food intolerance, because then the body could store the toxins in the connective tissue, in the ligaments, in the muscles, in the fascias, and that could create the problems of a rheumatic disease too. So you see, we have many different complaints, many different diseases, which are more or less related to intolerances. How could that be that you can't find this in the mainstream medicine? Therefore, it is important to look at the diagnostics at Mayr and also in the modern Mayr medicine from the understanding and from the philosophy. For us, the intestine is one of the most important organs for these diseases. Normally, when you take your food, the digestive tract has to digest the food. And when we are talking about allergies and intolerances, we are talking also about protein. So the protein is not the protein which is your organ-specific, your individual protein. It is a protein maybe from different plants, from different animals, so it's a non-human protein, and we have to ask the question, why do we accept this protein in our system? Protein is a very interesting substance. Everybody has his own protein, and we do accept only our own protein. So we have to make sure that our digestive tract is able to metabolize, to digest the protein which is coming from the outside. Protein is a big molecule of different amino acids, and so the function of the digestive tract is to cut the single amino acids from the protein. These amino acids we are reabsorbing in the intestines, and in our metabolism, especially in the liver, we are producing our individual human protein. If there's any problem on this way of digesting the protein, transporting through the different parts of the body, the tissues, and metabolizing that new protein, human protein in the liver, then we will get an allergy. Allergies are also related to the borders of our organism. So it is related to the intestine, which has a huge surface. It is related to the lungs, or even to the skin, which is with about 2 square meters, also a big organ on the surface of our bodies. So on these borders we have the contact to the environment. And normally when you eat some protein, it works very well in digesting this protein. If not, and there we have to look on the process of digesting itself. If not, then we will get the problem. Normally, when we are talking about nutrition, this is a very well balanced function between our enzymes, our capacity in the digestive tract, and the intestinal flora. If the intestinal flora gets enough to stay alive, but not too much, everything is fine. Then we are able to metabolize most of the food with our enzymes. If not, if you eat too much according to your capacity, or if you eat too much at the wrong time, for example, raw things in the evening, then you are not able to digest the food properly, and the bacteria, they will get more food to work with than usually. And this process of metabolization is totally different than for our organism. Bacteria, for example, do metabolize carbohydrates in the process of fermentation, and they do metabolize protein as a putrefaction. Both processes, they lead to the production of different toxins, and this is the reason Mayr was speaking about an intestinal autointoxication. This intestinal autointoxication is the first step of a food intolerance. When you have a fermentation in your intestine, you're producing a lot of alcohol. Alcohol, on the other side, we know is a substance which dissolves and irritates fatty tissue. And the border, the membranes of the intestines are fatty tissue. On the other side, if you look on the protein, and if you have a putrefaction of protein, we are producing histamine. And histamine is the main substance creating inflammations in the body. An inflammation in the intestine again leads to an increased permeability, so different substances from the intestine could be past this border of the intestines, and then behind the border, like a police, there is our immune system. And the immune system will now be stimulated by these substances, and of course will react to that. As long as the liver is able to metabolize these substances, detoxify them, everything is fine. If not, if these toxins are spreading over into the body, then we will have different reactions from the food intolerance. So our main interest is to make sure that we are able to metabolize the food inside of the intestine and nothing is going through except the substances, amino acids, sugar molecules, which are allowed to pass. Therefore, it's important to look at the Mayr Medicine and the recommendations of having the food. So take time for your meals, look at the eating habits, enjoy the meals, but don't eat too much and don't eat too late in the evening. When we are looking on the different reactions to the protein, we also see very often reactions to different proteins from cow's milk or from cereals like wheat or other cereals containing the gluten. It's also interesting to see that these substances create a lot of metabolic byproducts which will be handled in the body very similar to substances like morphine. And so you will get also an addiction to that. So you eat exactly the substance you are not able to metabolize. Therefore, it is important also in the therapy then to avoid these substances for a longer period of time. Interesting also is that we are not reacting only to proteins, we are also reacting to sugars. And sugar, it's normally a very simple substances to be metabolized, but we have some sugars, they need a very specific form of metabolization. This is sugar like lactose or fructose. And therefore we have to look also in the details of intolerances to that sugar molecules. If the sugar again is not metabolized in the intestine regularly, the bacteria, they create some fermentation processes. These fermentation processes produces some substances like hydrogen, which is reabsorbed, and we do exhale this hydrogen in the lungs. So therefore we can take a specific test of elimination of hydrogen to clarify or to diagnose the situation for an lactose intolerance. This is a breathing test where you will be challenged with the sugar molecule, so you have to drink some lactose, and 30, 60 or 90 minutes later we will detect the amount of hydrogen in the breathing. And if that climbs up on a certain amount on a certain value, then we see very clearly this is an intolerance to the sugar. Lactose has also a very physiological expression. We are able to metabolize this sugar very simply during our childhood, but when we become older, we get weaker in this lactose metabolization. So in adult persons, we see in about 50% an intolerance to lactose. This is a very normal process. Additionally to that, we also have a difference in the geographical expression of this intolerance. If you look to the north hemisphere of this earth, you will find it very rarely. If you go more south or more east, you will find it more often. So for example, in the Asian nutrition, lactose and especially milk and yogurt is not that important than in the European and in the Western nutrition. These differences are specific to the genetics expressions of these interons. So we have to know that in our areas, Middle Europe, in about 13 up to 50% in the population, we will find these lactose interons. And if somebody is lactose intolerant, he has to avoid the food containing a lot of lactose. And this is mainly during the processing of food, so at the end, if somebody is lactose intolerant, he will have cheese, but not the milk and the yogurt. Totally different to that is the reaction to fructose. And we have to ask again, why should a very simple molecule and an important food like fruits be intolerant to the body? We find that very rarely as a genetical expression, but we do find it very often if somebody has an intestinal problem, and especially chronic inflammatory process in the intestine. Because it could be that this inflammation irritates exactly the enzyme which we need to reabsorb the fructose, and in that situation the fructose will be again in the intestine fermented by the bacteria and creating these problems of the fermentation. Additionally to that, and this is specific to the fructose, specifically it will be complexed an amino acid, tryptophan, with this fructose. And so this tryptophan is not reabsorbed well. We don't have enough tryptophan then in the body, and tryptophan is the most important substance to create serotonin and melatonin. Serotonin is related to the metabolism of, let's say, feeling happy, feeling lucky. It's also called our lucky hormone. And melatonin is the main substance to create rhythms and helps us to fall into sleep. So additionally to the problem of the intestines, we will have effects on the mood. We will have mood swings. It could be a depressive disorder as an effect of the fructose intolerance, or it could be a sleeping problem. And again, interesting, in very often, in many cases, we will find a bacterial overgrowth in the intestine and also parasites in the background of this fructose malabsorption. It could be that the toxicity of the bacteria and the parasites are irritating the enzymes to reabsorb the fructose, and then the fructose malabsorption is the complaint from this infection in the intestines. In the therapy, it is important to make sure that you avoid the intolerant food. The minimum time is about 3 months, especially if you are intolerant to a protein like cow's milk protein or gluten. You should stay away that for this period of time as consequent as possible. Later on, it may be possible to have it again if you have established again the border in the intestine, and this is up to a very effective Mayr therapy. The second, in the diagnostics according to Mayr, we do see the inflammation in the intestine, we do see the reactions, but we can't clarify the situation if the inflammation is related to an intolerance to cow's milk protein or to wheat protein or to the gluten. And therefore, we like to do the applied kinesiology test. In this functional muscle test, you will be challenged with the food, and you can see very directly, very specifically the reaction to the intolerant food. If you're creating a weakness in the muscles, this is always an indicator that the food is not tolerated. The same reaction you will have in your intestine. Your intestine is a tube of muscles. If the muscle, for example, of the leg, which is related to the small intestine, becomes weak, your intestine is weak in the same way, but we can't test the intestine in the same way. So therefore, indirectly, your muscle is the representative of the inner organ, the small intestine, in that specific case, which shows the intolerance. This applied kinesiology test also is very helpful for us to see what kind of medication will be specifically helpful in your situation. So we try to find the medication, for example, against the parasite infection or also against the histamine reaction, and that will strengthen immediately the muscle again. So the applied kinesiology test is very helpful as an additional diagnostic tool to clarify the situation. Of course, we can use also different blood tests, but it's sometimes a little bit tricky to find the right test, and it could be that you are reacting in a totally different way. Very often we see food intolerances related to IgG immunoglobulins, but not to the IgE type, which is checked very often in the mainstream medicine. But it could be also a cellular related immune type, and then you don't see this in this reaction. So a blood test needs more detailed information, it's more cost intensive, and it takes more time than the applied kinesiology test. In the therapy again, it is important to stay away minimum for 3 months to avoid the food for 3 months. And after that you should be rechecked, and maybe it will be possible to have the food again. The lactose intolerance, it's a little bit more difficult, because when we become older, the weakness of the enzymes becomes more acute, and so then you will be more intolerant to the lactose when you will become older. So if you are diagnosed with a lactose intolerance at the moment, that wouldn't change in the future. So the consequence would be to stay away from the lactose more or less for the rest of your life. But in that case you can have the sheep cheese, or you can switch to soy milk or other plant products which have no lactose, because the lactose is only in the animal milks. In summary, I think it is important to clarify the situation of food intolerances, because they are influencing our health in a very specific way. And it's so simple to stay away and to strengthen your health, avoiding the intolerant food. Therefore, we want to help you for the future.